Okay, good morning, everyone. Thank you so much for joining.
صباح الخير الجميع شكرا على
We will start in another minute.
هنبدأ بعد دقيقة.
We will be adjusting the translation while we wait.
احنا
So I am in English and I'm hearing the Portuguese translation, just noting this for the staff that is handling the translation. If you can look at the assignment for the language, please. And let's give it another minute while we sort out the translation. Thank you. And also allow people to join. Okay. While folks are joining, please go ahead and introduce yourselves in the chat. Your name and your the country from where you're calling. Okay, and I'm just going to wait until another minute or so and we'll get started. Again, thank you so much for joining us on this webinar on strengthening partnership with faith actors in family planning, a strategic planning guide. Let's give it one more minute. And it is really exciting to see all of our colleagues joining from all over the globe. Okay, so let's get started. So this webinar will be recorded. Thank you so much for joining. It is our pleasure to welcome you for the webinar today. My name is Maria Augusta Carrasco, and I will be your moderator. I am a Senior Implementation Sciences Technical Advisor in the Research and Technical Utilization Division of the Office of Population and Reproductive Health at USAID. Again, thanks for joining. We are very excited that you're here. And I am actually particularly excited because we have translation. I've never been in a webinar with translation in 4 languages. Please make sure that as you enter the Zoom, you choose your language from the bottom of the screen. So make sure you choose the language in which you will be listening to the webinar. And if it's English, please do choose English because one of our speakers will be speaking in French. And for that part of the program, you will need English translation. So again, please make sure to choose your language from the bottom of the screen on the language icon. I'll give people a minute to do that, and then we'll get started. Yes, and while we are choosing the languages, yeah, if there are any challenges with the translation, please put it on the chat. And our fantastic colleagues who are handling all the logistics will address any challenges. And please be patient with us as we figure these the translation. Okay. Okay, so let's get started. Again, today we'll be presenting a strategic planning guide to engage faith actors in family planning programs. And our first speaker is Mona Bormet. Mona serves as the program director for the faith engagement team of the USAID-funded Momentum Country and Global Leadership Award, and she is the program director for Christian Connections for International Health. She directs a global portfolio of initiatives that improve timely access to quality health services in communities and facilities by working with faith partners. Mona was one of the lead authors of this strategic planning guide, and she will be giving an overview of the process that was followed to create the guide and a little bit of an overview of the guide. So with that introduction, Mona, thank you so much for all your work and for presenting today. Over to you.
Thank you, everyone. We've been told that there's an issue on the Arabic channel because both of the Arabic interpreters are speaking at the same time. So we apologize for that, and we hope that the Arabic interpreters will decide amongst themselves whose turn it is to interpret. So we apologize for that, but we hope interpretation is working for others, and we are very glad you're here. So good morning, good afternoon, good evening to everyone. I'll be sharing a bit about how this high impact practice strategic planning guide, also known as HIP SPG, came to be. So next slide, please. If you go to the HIP SPG website, you'll see the link on the left side of the screen. There are many different types of high impact practice strategic planning guides. So we are very excited to share with you today the strategic planning guide on strengthening partnerships with faith actors in family planning. And all of the HIPs have a similar mission, which is intended to lead program planners and decision makers through a strategic process to engage and strengthen partnerships. Now, in this specific instance, it's to strengthen partnerships with faith actors in family planning. So this guide was developed in consultation with technical experts and builds on key resources that are noted throughout the guide. So if you go to the website, you'll find the HIP in Arabic, English, French, Portuguese, and Spanish. And we're very excited that this is the first HIP that has ever been translated into Arabic, because if we're working with faith communities, we really felt it was important to ensure that this HIP was translated into that additional language. So next slide. This is a busy slide. It has a lot of information, and it's meant to just show you the thoroughness of developing a high impact practice. So we went through where we had to apply to create a high impact practice. It went through consultation. We had experts review. We had people review the translated versions. And now we're here to share it with you. So we're just really excited that we've been able to do this process and have something publicly available about how to strengthen partnerships with faith actors on family planning. So next slide, please. I'd really love to acknowledge the many, many people that helped with this high impact practice, including Karen Hardy, who really helped lead the writing of the high impact practice, and Laura Rainey from FP 2030. And then the second bullet describes the people that participated in the consultations that we had to create the original drafts of the high impact practice. And then the third bullet shares all the many people who helped review, give technical expertise, reviewed from a technical family planning angle, or who helped review it from a technical, whether it was Islamic or Christian or whatever perspective, that angle also. And so just really grateful for the many reviewers. Next slide. So this high impact practice really focuses on 4 key actions, which you can see on the slide. And I'll be giving just simple examples from each key action, and then we'll have other speakers who will give in-depth examples. So next slide, please. So for key action number 1, of the 4 steps that we really feel can help you strengthen the ability to work with faith actors on family planning, is that we really believe that you should know who are the faith actors working in family planning in your geographic context. So that could be your district, your county, your country, your region, or the world. But do you know who is working on family planning? Is there data available on the work that they've done? If not, please look, try to conduct an inventory of who the faith actors are, and what is the public published literature. And when we talk about faith actors, that could be a religious leader, that could be someone from, or an organization, a faith-based organization. So multiple layers of faith actors. And we really hope that this key action number 1 ensures that you're engaging in conversations with key faith stakeholders to understand their beliefs, their questions about family planning, their needs in their communities, and also for them to have that relationship with you and your organization to help develop a relationship for the long term, not just for a short-term project. So that's key action number 1. Next step, please. Or next slide, I should say. Are others seeing the next slide, May? Oh, there. Thank you. Sorry. So key action number 2 is, how can we determine how faith actors can more effectively contribute to family planning, policy making, and program? So once you know who's working in your area, we really encourage you to develop early partnerships and discussions. We find that when faith actors participate in technical working groups in their countries or their counties or their districts, they're more engaged, they have ownership, they're able to have more dialogue and ask any questions or concerns, and also find ways to discuss how the scripture or the religious texts and technical knowledge on these issues can all be discussed and addressed when it comes to any concerns or any gaps of knowledge or misunderstandings. And it helps us understand the role of the faith actors, but it also helps those faith actors understand you. An important part to know is, if you'd like faith actors to contribute to policy making and programming, they also need to be financed, or you need to know how they're financed, and they need to be treated as equal partners in the process. Next slide, please. So for key action number 3, once you've done an inventory, you know who's working, hopefully you've developed a relationship, you've really identified now their capacity and the resource needs so they can fully participate in family planning programming. So for faith actors to participate, just like other civil society or other stakeholders, planning and budgeting needs to be included. So what are the resources they need to be advocates, to implement quality services at healthcare facilities or in community-based programs, to train their healthcare workers, to participate in those technical working groups, to have consultations with them, and to help sensitize religious leaders and engage them in social behavior change communication programs. And it's not only doing all that, but then prioritizing budget and funds to strengthen these capacity building activities for faith actors. Next slide, please. And then key action number 4 really focuses on, you've developed relationships, you've identified who they are, you've identified budget needs, and now developing really an action plan to include them and monitoring that action plan as people are acting and being engaged and involved, to make sure that the plan is contextualized, of course, for your geographic area or for your context, to make sure that any challenges are addressed for that specific situation, and that it shouldn't just be a plan that's developed at the beginning and then it's never looked at, of course, but it's periodically reviewed. And we also believe that FBOs need to be a part of national HMIS systems and national forecasting and quantification exercises to ensure that data from their facilities and their programs is part of national level data, and also part of forecasting and quantification for supply chain issues. So next slide. We're really excited about these 4 steps that we believe that will, these actions that will really help you strengthen your relationships with faith actors. And we hope you share about this new high impact practice strategic planning guide There are some examples on the screen. We'll put some examples in the chat box. We hope you post on social media or LinkedIn and would really appreciate your help spreading the word. So next slide, please. I just want to thank you, and I want to thank Momentum Country and Global Leadership in particular for their support of this project. So over to Maria, and thank you all.
Excellent. Thank you so much, Mona, for that great presentation. And again, thanks for all your work in the strategic planning guide. I know it took a lot of work, as you showed us in that journey slide, where it was actually quite some time and involved, but that process of engaging, of listening and integrating several voices is critical to see the great product that we hope is going to be helpful to all of our colleagues listening today, and also to others who may listen to this recording or access the resources at a later time. Okay, so with that, we go to our second speaker for today. Her name is Clemens, and I apologize, I cannot pronounce her last name. She will be speaking and providing examples of key action 1, which, as Mona just shared, is knowing the faith actors you work with in your geographic context and having a deliberate plan for engaging and working with them. Clemens is a country director of World Relief in Rwanda, and she has 15 years of experience in international development, church engagement, and faith actors engagement in Christian majority contexts. Prior to her current role, she was the Global Technical Advisor in Integral Mission. She serves currently as one of World Relief's gender focal persons of international programs, and she has helped to work on mainstreaming on gender into various plans and operations and programs. So with that, I pass it on to Clemens. Clemens, thank you so much for being with us today. Over to you.
Yeah, thank you, Maria. It's a pleasure to be here. As she has said, I'll be presenting on the first action, mainly how we engage faith leaders in family planning. Next slide. Yeah, World Relief works with in different contexts, mainly humanitarian and disaster response. So I will mainly be talking about one of the projects that we implemented, a SCOPE project, and where we engaged faith leaders in family planning. SCOPE as a project stands for Strengthening Community Outcomes Through Positive Engagement. And the entire project looked at the ways to mobilize and support women and caregivers of young children. So the focus, the topic were on the family planning, pregnancy, safe delivery, postnatal care, and other related objectives. The main goal was to contribute to the reduction of preventable maternal and child morbidity and mortality in selected districts in Haiti, Kenya, Malawi, and South Sudan. As you can see, key objectives, there were many that were supposed to be taking place at the community level. One is improving the adoption of the health-seeking behavior. So that is where even the engaging of faith actors was a big achievement. So I will start, next slide, please. I will start sharing how did we map different faith actors who have been able to work with. In those 4 countries, World Relief was already operating in those 4 countries, but are not in the district we worked in. So the first step, I think, as Mona has said, is the inventory. So we used secondary data of the faith actors that are already in the area. So that is like a systematic approach of having a list, just working with any stakeholder that may be the district authority who can have the list of the faith actors in the same area. So we did that mapping, and then that also involved the physical visiting of a faith institution, those districts, and record the names and the key contacts to make sure that we at least have everyone. So the second was step was like, how do we make sure that no one is left out? In that step, it was mainly engaging the Ministry of Health in every country to make sure that we have faith actors who are already engaged in the family planning and health programming. Also working with the denominations at national level to see if they have other extra information. So once we had most of the information in terms of who to contact and who to engage, the key was not to find those who are already doing it, but everyone who can play a key role in the process. So once we had them, the mobilization process started. So the mobilization process was to sell the idea of how can faith actors consider this family planning and health programming as the objectives of the project well, something that they can relate with. So one of the key activity we conducted was to conduct different meetings at national level, at county level, and at district level. So we could bring the main religions identified. In our case, in most of the countries, those were Christians and Muslims, and few traditional religions in Kenya. But the Muslims and Christians were the dominant groups that we worked with. So the first initial meetings were kind of a half-day meeting that helps to understand why they should support and why is it really important in transformation we want to see in the behavior of seeking health services. So that also fed in our mapping, because the information that was lacking was we were able to add it in that process. Next slide, please. Yeah, as we engaged them, there were kind of different activities we were able to do. Those activities include trainings, includes meetings, includes regular follow-up, it includes feedback meetings, and also the launching of different programs that they were able to implement as faith actors. So please go to the next slide. I'll combine this slide and the next one to make it more clear for you, all of you, to understand the process. So I would say, as I have said, the first step was to mobilization. We were able to engage over 2,800 faith leaders, and also we trained them, first of all, to encourage them to support the project, and also we introduced a tool we call Making Our Community Better. I'll say more about it in the next slide. But out of that, because it's a 3-day training, that brings out actions. So one of the outcomes, they form a faith network committee, and throughout the 4 years of the project, they continue to work together for the health initiative purposes. So that we call it as kind of laying a solid foundation. Even if we're not having other interventions, they can still be able to advocate, to address things that they are able to address at their level. One of the examples you find in Kenya, they were able to build a shelter for expectant mothers at the clinic or health facility, because that was not available. That was in the Turkana County. In addition, we added another module that is called Family Life Education, that is also would be used by both Muslims and Christians to go in deep to discuss reproductive health and family planning. So those are the kind, how the whole process goes, and how we continually engage them in the programs as stakeholders as we build their capacity. Next slide, please. I'm now going to talk about what is it bring change using making our community better and why it is a unique tool. This slide discusses about the process we went through, like training in all countries, and also the rollout of the training material, which is like a 3 days training. But you can go to the next slide, maybe for the sake of the time for people to understand the content of the material. So as you can see on this slide, we were able to reach out over 2,800 faith leaders, and we have 6 lessons in this module. It has been approved by USAID to be used by both religion, Christian and Muslims. They also participated in the validation of the tool before it was even shared with the USAID. So the tool itself is based on the conversations. People are able to talk around why do I even, as a faith actor, to contribute to the community development. That is a best way of raising awareness, but encourage the buy-in. So we add stories and conversation. They do the community mapping, they understand the resources they have, and also the capacity they have as faith actors if they work together. So we talk about what is their role, what are the things they have been doing, and how does it, what they think they are in the community to do, connect with the health issues. So we talk about how can we do transformational development, and we emphasize on how to work together, mainly because that is how we want them to continue to work together to address issues. So that training takes 3 days, and we have been able to see the change it brings, because even after 2 to 3 years, you could go back and find them still finding a way of using Madarasa to pass on the messages, or the youth groups, or the women and couples groups to be able to discuss the family planning. Next slide, please. This will be a slide where I talk about mainly on the lessons we have been able to learn. In this process, we have been able to learn that even if we talk about sensitive topics like family planning, faith actors can play a key role in community engagement. First of all, when they understand, they always have a platform and they have a way of communicating with their community members. So I have seen that they play even linkage to health facilities like the community health workers. They do a lot of referrals, and they can also continue to follow up. For example, if there is a woman who's going for the prenatal care, and the faith leaders can easily follow up and encourage, even when the community health system still have some gaps. So engaging them, it's reinforcing the process, and connecting them to existing system, help them to even contribute to reduce the barriers to behavior change, and also contribute to adoption of new behavior. The final slide, please. That will be the final one, just to thank you and also tell you that we have tools that we have been used that are available. The links are connected. You can still be able to reach to the facilitators to share these links with you. Thank you so much for paying attention.
Excellent. Thank you so much, Clemens, for that great presentation and sharing about details about step 1 in the strategic planning guide, which focuses on mapping faith actors. I want to take a minute to encourage all of our webinar participants to please put their questions in the Q&A box. We will get to the questions after all of our speakers have presented. I also wanted to take a short pause to call your attention to the fact that the strategic planning guide is only 4 pages. So you have the link to the planning guide. It was shared in the invitation for the webinar, and we can also put it on the chat. and it's a short document. And the reason why it's short is because we want it to be very user-friendly and easy to go through. We know we're sometimes inundated with information and documents. So the idea of keeping it short is to make it remove a barrier to look at the document, because again, it's a short document. Now, the fact that the document is short means that the group working in the particular strategic planning guide has to make very difficult decisions of what to include. So the items that our colleagues have included in this strategic planning guide are critical items, are critical steps that need to be integrated in these efforts to engage faith actors in family planning programming. And that said, there are a lot of very useful tools that are hyperlinked in the strategic planning guide. And actually, our third speaker today is going to focus his presentation on sharing with us why is it important to have tools specific to faith communities, to work with faith communities. He will be speaking in French. So for those of us listening or in English or participating in English, please make sure to choose the translation at the bottom of the screen. So we welcome Sheikh.
Maria,
Yes?
I apologize. The Sheikh will actually be speaking in English
Okay.
because the interpreters can only translate from English into the other languages. Sorry about that.
Oh, no problem. No problem. And actually, we are lucky that Sheikh Bakeh speaks Spanish, French, Arabic, English. I was just like we were getting acquainted. Yeah, a true polyglot. I wish one day I can grow up and be like that. But anyways, we welcome Sheikh Bakeh, who is the president of the CRSD, the Religious Association for Health and Development, which is a Senegalese organization, and he is also an international consultant. Sheikh Bakeh is a spiritual leader of the Murid family, which is a core institution of the Senegalese Sufi Islam, and he has lived within the tradition since birth. He was educated in Tuba in the Islamic Quran tradition, and then at the University of Tunis and the University of Salamanca. With this, I'll pass it over to you, Sheikh. Welcome, and thank you so much for being with us today.
Thank you very much, Maria, and greetings to everybody. It is a pleasure for me to share with you our work on family planning as religious leaders of Senegal. Now, my personal involvement in the family planning conversation has been very spontaneous through friendship with Catherine Marshall, whom some of you may know. When she got some funding for a project involving religious leaders of Senegal on family planning programs, she shared with me the idea and asked me if I could lead it. And at that time, I did not have any idea about family planning, so I had to go back home and research what Islam and says about Islam, which is my religion, says about family planning, and then try to do that. So the first thing we did was to carry out a very wide consultation among my peer religious leaders in Senegal, both Muslims and Christians, because I have done a lot of interfaith work before doing family planning, involving Christians and Muslims and even traditional religious leaders. So I had to make it interfaith to be so that it is more comprehensive as possible. Family planning. What I know about family planning now, I knew it actually through thanks to this project, because the project urged me to go and research what the scriptures say about family planning. Religious leaders is interpreted is a sort of alerted when it is a matter of life and death for people. The Minister of Health of Senegal said that the mortality, mother and child mortality in Senegal was very high, that was the main entry point, the easiest entry point for us to be involved in this family planning conversation. And they said that by promoting birth spacing, we could contribute to the to reducing the mother and child mortality, which was a very easy point, something you can sell to religious leaders, as I said, because of sacredness of life. Now that also meant to find religious argumentation in the favor of family planning. So we had to go to the books and reread the books and to find out what the books are saying about family planning. So that was the first step, was then a sort of a rereading and a narrative rereading, and find out what the book says about family planning. So we engaged the two experts on that, for that matter, two consultants who came up with then this book. I'm allowed to share the screen, if possible, so that I can share the screen and show you the Islamic argumentation on birth spacing, which we developed. Yes, is it possible? Oh, okay. Well, I keep trying. Okay, here it is. This is the book. It does have an English version, which I also shared the links in the chat box. So in Islamic, it has a French version and then also an Arabic version, as you can see. It is a book that is based on what other Islamic scholars have said about family planning, but also includes input from Senegalese senior-most religious leaders, their view on family planning. So we gathered all that in this argumentation, which also deals with not only Islamic scriptures that are in favor of family planning, but also other interpretation, other reading of the texts that are not in favor. So we gathered opinions and views that are against, and we contrasted with views that are in favor, that are for, based on the scriptures. So we contrasted these two. We came out with an affirmation that the Islam is in favor and rather even encourage birth spacing amongst married couple, to save lives, and then for the well-being of the mother and the well-being and the health of the child, and also even for economic reasons, so that the family is empowered enough to have enough to live off. Some of the scholars that we quoted in the book even say that family planning allows for a woman to keep her beauty, to keep pleasing her husband. So it is a very comprehensive study of Islamic position on family planning. We widely disseminated it throughout Senegal and also outside Senegal in the region. We also shared it with other scholars from the region, from like Mauritania, who found it very comprehensive and very acceptable, as an Islamic source of information on family planning. The challenges were that, okay, as I said to you, there were some detractors, some who were against, family planning, but they didn't have solid arguments against it. So those used to come out in the media before we produced this book, destroying the family planning, saying that it is against Islam and all that. But when we produced this argumentation, then they stopped doing that because they didn't have any arguments based on scriptures, at least. So the book now is widely accepted in Senegal, in the region, and we've shared it and disseminated it, in many places. The outcome, the best outcome that we are very proud of is that the Ministry of Health itself says that this has contributed to the rise of the CPR in Senegal, and even though it is difficult to quantify how much our intervention has contributed to the rise of the CPR, but they acknowledge and they say that due to the advocacy we've been doing, there has been a significant behavior change amongst people, amongst women, and even men's view, on family planning. More men are allowing women, their wives, to do family planning, thanks to the book, because they were reluctant before to allow their women to do family planning because they thought that Islam was against it. Now, maybe the other one is that I need to talk about the Christian views. With this book, we don't have Christian perspectives because Christians, well, when we consulted with them, they said that, well, okay, given the different, views, because like the different position with between Catholicism and Protestantism about family planning, they didn't come together with consensus about what scriptures from Christianity we would put in this book. But we still encouraging them to do that, and we actually produce another argumentation on the youth and adolescents' health with Christian perspectives. So we continue our efforts to have as many perspectives as possible from both Christianity and Islam in our narrative rereading to promote family planning. Thank you very much.
Excellent. Thank you so much, Sheikh Bakeh. We very much appreciate your presentation. And again, for our audience, please make sure to put your questions on the chat. Feel free to put your questions in your language. We will be using translation to be able to get to your questions, and we will get hopefully to as many questions as possible, if not all of them, after our next speaker. So again, thank you very much, Sheikh Bakeh, for that great presentation. So now let's go on to our fourth speaker of today, and he will focus on the key action number 2 in the strategic planning guide. Our speaker is Mr. Yoram Siame. Yoram serves as Director of Advocacy, Planning, and Development at the Churches Health Association of Zambia. Before joining this organization, Yoram co-founded Youth Alive Zambia, in which he managed HIV/AIDS programs. And he works with religious leaders, training them to advocate for family planning in their communities and with their governments. Yoram, thank you so much for joining us from Zambia, and I pass the floor to you. Thanks again.
Thank you very much, and good day to everyone. I want to start by apologizing. I'm recovering from a flu, and I know that people have written on my profile that I'm a very engaging speaker, so I have to rise to that challenge. But greetings, everyone, and it's a pleasure to take you through some of our experience, particularly in Zambia, working with the Churches Health Association of Zambia, of how we have experienced working with faith leaders in promoting family planning outcomes. Next slide. So the first slide is just trying to make a point. The point is that on the African continent, we have Christian health associations which provide significant chunk of the health services on the continent. And Charles does that in Zambia. It is the largest non-governmental provider of health services. And in that sense, it's second only to the Ministry of Health. And as you can see there, we have hospitals, rural health centers, training schools, specialized hospitals, and community-based programs. Next. So I'm going to speak about two issues. The first one is identifying capacity and resource needs of faith actors to more fully participate in family planning programs. And the reason I am sharing on this is because we have learned that many people who have tried to engage with people of faith in promoting either family planning or other health initiatives usually get frustrated. And in the end, whilst they understand that religious leaders have got a lot of influence, can bring about change, they then fail to harness that power to bring it on board to actualize the objectives of their health interventions. Next. So in the case of Zambia, what we do in working with the religious leaders, the first thing we did on family planning was to ascertain what the understanding of faith leaders and their followers on family planning was. And we engaged about 18 church mother bodies, religious groupings. These are both Catholics and non-Catholics. And what we found was quite interesting. The first thing we found was that there was a disconnect between what the church members understood to be the church's position on family planning and the actual position. So some members would go as far as saying, my church is against family planning. They don't allow it. And when you ask them, where did you learn this? They were unable to point it out because it was just assumed, maybe it was passed on through tradition. Another finding we had was that the position of the church was unclear within the clergy. So not just among the members, but among the clergy. If you ask them the same question, they'll give you different positions. And we also found that there was a disconnect also within the clergy, but also within the members of the church. The other thing we found was that some churches had very well-articulated positions. For instance, they said we will only support family planning under these conditions. But what we found was that they lacked any program to actualize that policy. So, for instance, a church could say, we only espouse natural family planning. And when you go and look at the people who are being trained into marriage preparation, you find that there is no content whatsoever to give them the skills to actually practice the family planning method that the church's doctrine espouses. And the last interesting thing we found was that faith leaders had information and knowledge gaps on national policy on family planning. So if you ask them things like, is abortion legal or illegal? They'll take a position which, when you check the actual policy documents, you find something else. So these were the core issues, which was part of our resource and capacity needs identification. The next thing we did, next page, next slide, we asked ourselves, what do we want the church leaders to do? And this is important. And we found that many people do not what they want the church leaders to do. Knowing what you want the church leaders to do is not as simple as that. It's also understanding the implications for what you want them to do. If you want a church leader, for example, to promote abortion, what do you really asking the church leader? Especially in the context of his institutional framework. Because some of the things we want them to do might be the equivalent of committing political suicide within their church. So we had to work out for ourselves, what do we want the church leaders to do? So after our assessment, we narrowed it down to 4 things. The first one was that we wanted our faith leaders to have accurate and up-to-date information on family planning, not just the national issues, but also within their churches. The second thing is we wanted the faith leaders to support people achieve their family planning goals. Of course, as long as they are in line with their faith. We also wanted the faith leaders to disseminate accurate information on family planning based on, number one, if a faith leader has got accurate information on the national policy, accurate information on where the church stands and why it stands on that point, in the same way that Sheikh Mbake demonstrated that when he went to the scriptures and did study afterwards, now he can engage not just in a scientific discussion, but he can have enough confidence to understand that there is absolute clarity and accuracy on the information he's providing from a religious perspective, from a scientific perspective, and he can authoritatively speak. And lastly, we wanted to take religious leaders beyond the perspective of how they are looked at, because many people who want to work with the church and religious leaders want to look at them as just VIP community-based volunteers. That these are people in the community who have very low understanding of bigger picture issues, and they can just be used for demand generation, just to dispel myths. We wanted and understood that our faith leaders were highly educated people, highly technical people, in addition to being religious. And because of that, they could bring something useful to the table in looking at the policies, funding, and the service architecture of family planning in different countries. So this was among our biggest wants. So we just didn't want faith leaders to have a sermon guide where they engage the congregation and tell them that God says this or the scripture says this. No, we wanted them to take beyond and engage with the duty bearers who have the responsibility to ensure that every man, woman has access to family planning options in order to save lives, in order to save children's lives, and in order to bring about healthier families. Next. So, what did we find when we engaged the religious leaders? We found also that in the asks we were asking of them, we found that they have hurdles which we have to help them navigate. The first one is not having answers. There is an assumption, and this goes beyond the health community. People in the environment, in human rights, people who are dealing with livelihoods, approach faith leaders as though somehow, by the power of some spirit, they should have accurate information. And they are angry in those instances when they have wrong information or myths and misconceptions. So we identified, because of our first assessment, that faith leaders, like everyone else, needs to be engaged to understand and have the correct information. So we needed to take time, not just to educate them, but to dialogue with them. Number two, we came to realize that faith leaders needed to be supported in securing permission from their institutions. Sheikh Mbake spoke about engagement even beyond his faith, the Islamic faith. He had to engage with Christians and so on. But most of the religious groupings, for a faith leader to speak about an issue, particularly with the public, but even more so, even with the faithful, they need to engage horizontally and vertically. They need permission. They need consensus. And this is important to avoid contradicting themselves in the public eye. What this meant was that they needed to be given time. And this is one of the greatest mistakes we learned that people make. People want to engage a faith leaders at 14 hours, and at 15, they want him to sign a big declaration, making a big statement about where the faith stands and what they are going. We recognize that this has led to a lot of challenges where some faith leaders have been kicked out of their faith communities, become shunned because they were not given enough time. And those who have told players or external factors who want to work with them, if they tell them, give me more time to study this matter, we also discover that they become impatient and move on and label them as non-progressive and things like that. And lastly, we also learned, interestingly, with regards to family planning, once we are thinking about faith leaders as agents who educate, advocate, and spread the good news of family planning, we forget that they are human beings and they also need family planning services. So what we learned is that there is a perception, for instance, that a bishop, a pastor, a priest cannot go into a supermarket. Most of them have what fear. The public is scandalized when they see a person of the cloth accessing something like a condom. Apart from HIV, a condom is also a family planning option. So one of the things we discovered is that people of faith, particularly the clergy, are also in need of family planning services, and they need services fashioned to their needs. Next and last. So the last thing that we did was to develop an action plan to strengthen inclusion of faith actors in family planning, and a mechanism to monitor the plan. So what did we do in this vein? Next. What we did was we trained the church leaders, the faith leaders, in family planning and family planning policies. After that, we supported churches who had doctrine gaps to develop a position on family planning. And I think Mona will share with us at a certain point, so that those who had shelved their family planning policies and completely forgotten about them and had gathered cobwebs would revive them. Those which were not sure, we helped them have a space where they could develop. Then we also trained the faith leaders in family planning advocacy using the quick wins. And lastly, after we had done the capacity for them, we merely facilitated and put them in platforms where they could speak for themselves. Because most of the time, like I said, we don't bring them to decision-making table. We take them into a class, teach them, and then we expect them to go in the community, like faithful community-based volunteers. What we did is we secured platforms so that they could speak for themselves. So if we wanted them to speak, to educate, we secured radio, TV, online, community meetings, and other meetings. For advocacy, we placed some of the religious leaders in technical working groups. I want to repeat that. Technical working groups. The family planning technical working group, we brought faith leaders in there to be able to be part of the policy discussions and inform some of the technical issues which were taking place in our country. Policy meetings, radio, TV, online. And lastly, we facilitated their sharing experiences with one another so that those who were a bit, doubting, how will my message be received? How will I be perceived if I start talking about these sexuality-related things? Are they going to harm my stick in my church, in my religious group? So among themselves, they needed to share experiences of what they were doing and what the results were. Next. So all this, what was the result? The result was, one, we have faith leaders who have got confidence to engage in family planning discourse, including advocacy. Two, we have learned that in order to engage faith leaders in family planning meaningfully, not just in supporting SBCC, social behavior change communication, but in engaging in policy and national dialogue, that you need to invest time, you need to understand and appreciate their context. They have got freedoms and constraints which are unique to their institutional setup. And because of this, we managed to achieve quite a lot in more than one country. I want to end by thanking the Christian Connections for International Health, who were our principal partner in implementing this. And this was implemented not just in Zambia, it was also implemented in Kenya. And we saw similar results being achieved. Well, I also want to thank the Zambian Ministry of Health, which has been very accommodating in engaging the religious leaders to the extent that even now it is part of our 2030 commitments. Thank you very much for your time. I submit.
Excellent. Thank you so much, Yoram. And thank you to all our speakers for today for sharing their insights and experiences with meaningfully engaging faith leaders in family planning programming. We again encourage you to continue to put your questions in the Q&A box. And we are trying to post various resources and hyperlinks to various resources in the chat. So if there's any documents that you still need access to, please let us know. So with that, let us go into our Q&A, our questions and answers session for the webinar. We have about 25 minutes or so. And my colleague Deidre is on the background taking all of the questions. So let's start with our first question. And this one, I think it's for Clemens or for any of our speakers. So how do you face the challenge of Christian groups or other faith actors who only see abstinence and rhythm, and in parentheses it says fertility with menstrual cycle, as natural alternatives that God supports? And this question is for Clemens and also for Mona. Over to you. And also any of the speakers who may want to come in. Thanks.
Can you go first?
Happy to. Hi, everyone. Thanks for the question. I hope I'm remembering correctly. I think the question was about fertility awareness methods or natural family planning methods, depending on the term that people use. I think family planning methods, there's so many choices, and there's so many choices because women's bodies differ, whether people want a short acting method, a long method, a permanent method. And we always believe that women and families, should be offered full counseling on all the methods, whether they are Catholic, Protestant, they follow the Islamic faith, whatever faith, whoever they are, they should be fully counseled on all the methods. And then they choose what's best for them, for their life, for their body, etc. And so whether that is a fertility awareness method, which is what many people in the Catholic faith follow, that's great. That's the method that's best for them. So I firmly believe I do not choose for someone else. We counsel for someone and they choose what's best for them. So I'm not sure if that answers the question, but I'll stop there.
It does. Thank you so much, Mona. Anybody else wants to add anything? No? We have another
maybe
great...
I can.
Oh, go ahead. Yeah, please go ahead.
Yeah, thank you for the question. Actually, I'll say that's the main barrier normally to engage faith actors, because they have kind of a set of methods they think they cannot even discuss. So what we've been doing is mainly engage, helping them to be aware how the methods are working, and also telling them you are free to choose this is what you can communicate with your congregation, and this is how you can communicate, and this is how you can do link to the health services. So you also explain how each method functions and the benefits and the rate of success. So that does not create any conflict because they still have a room to choose. And also they find a way of sharing the information with the rest of the community members. So we don't force them to abide with a certain method because it is still a subject of conflict in terms of belief system, but they also grow into it, like not prejudging it. Even some of them saying, "Oh, this has not been working. Why cannot I can consider the other methods that have been successful." Also bringing the different faith actors together and allow that platform of discussing on those sensitive issues. They can also learn from one another and what has been working in different faith institutions. Thank you.
Thank you so much. Let's go to the next question. This question, I think, is for all of our panelists. Why do we want church leaders to engage in family planning work, or why should they engage in family planning work? So who would want to get us
I
started?
can start.
Yes, go ahead, Yara.
You see, the church or religious institutions are very much a part of someone's life, most of us, from birth to death. And in most instances, the union between a man and woman is actually blessed and consecrated. That institution, the religious aspect, sort of makes it, is a central part of that. So one cannot say that the method by which human beings are created, the way in which us human beings co-create with God, is none of the church or religious institutions' business. It is very much, because whilst we believe in life after death, we also believe in life before death. And not just life before death, but the quality of life before death. And because of that, the holistic ministry to someone has to include their health. And family planning is a very integral part of maternal and child health. So yes, we are all going to go to heaven one day or another place, but for now, we are in these bodies. And we have to live healthy and productive lives. Family planning is a core component of that aspiration.
Great. Thank you very much, Yoram. Anybody else? Sheikh, do you want to add anything? I see you unmuted. Go ahead, please.
Thank you. Well, why involve religious leaders in family planning work? As I said, I'm a religious leader. I didn't know much about family planning before I got involved in this project. So it's just that, the project has helped me to do something that I feel I should be doing as a religious leader, you see? But the project has prompted that interest all of a sudden. If I hadn't been the project, maybe I wouldn't have been interested in researching what my religion says about family planning. Yet, it is part and parcel of our daily care and of the well-being of our followers, which is a mandate. Family planning is one of them. I mean, we do take care of the health of our followers on a daily basis, on other matters, on other health-related matters, be it malaria, I don't know, whatever. We provide money for the followers to go and buy medicine. So why not family planning as a health matter, you see? And the other one is that, as Yoram has said, God has called us to organization is so important, including for our families. Organization, we actually, we call it like the Arabic translation of the argumentaire is the organization of the family. Organization rather than family, we just call it organization, which is a very broad has a very broad meaning. That means God, religion accords a lot of importance in the organization. So if you don't organize anything, it will not work properly, including your proper family, your own family. Religion says, Islam at least says that quality prevails over quantity. You know, it's not a matter, and we put that in the argumentaire. It's not a matter of children you have, but the quality of the children. You have to be able to take care of them, educate them. You know, all that. It's not a matter of bringing into being children that you cannot afford to feed, and they would be street children. They would be, you know, engaged in criminal activities, etc., etc. So like quality has priority over quantity, you know. And like I said before, you know, the argumentation goes even in some instance where a religious leader says that, where the scholar says that a woman is allowed to do family planning for the sake of her own beauty, to keep pleasing her husband. That means, you know, that harmony in the family, in the couple, all that family planning is allowed to keep the harmony and the love between the couple. You know, all these are actually, you know, religious argumentation on the apart from obviously saving lives.
Excellent. Thank you very much. Let's go to our next question. This one is for Mona. CCIH is an organization based on the Christian faith, and its members are organizations, I'm sorry for the noise, are organizations with a Christian vocation. Is there a biblical basis for family planning on which CCIH has planned this webinar?
Thanks for the question. So I guess I'll start at the end. The webinar was planned in partnership with, IBP and the HIP SPG network to talk about this new high impact practice and how do we strengthen working with faith actors on family planning. In terms of the biblical basis for family planning, we've spent a lot of time looking at what does the Bible say about health, about quality of life, about how we care for each other, how we love one another. And so there's a lot of resources linked in that high impact practice document to things for the Christian community, for the Islamic community, for Hindu, Buddhist, etc. So we hope that you do look at that document and all of the resources. I will say that I think this is also related to some of the other questions. And so I'll just try to maybe answer a few questions together. There was a question that referred to, what does the Bible say about different things? So you have the verse from Genesis 1:28, to be fruitful and multiply and fill the earth. But I think we believe that it is not my job to be fruitful and multiply by myself, right? It is our job. And then there's another verse from John chapter 10:10 about abundant life. I came that they may have abundant life. And I think this is related to also what the Sheikh just said, is to have abundant life. We want our children to be raised in a healthy manner. We want the mom to survive childbirth and to be able to take care of her children. And in order to do that, healthy timing and spacing of pregnancies is proven to be the best way to reduce maternal and child mortality. And so there's a lot of data, but then there's just also a lot of teachings from the Bible about how we care and love one another that I think meld very well with why we support family planning.
Excellent. Thank you so much, Mona. Another question. Experience shows that many faith actors are against family planning messaging, believing that it is against the religious norms, especially among Christians. How can this belief be addressed with this high impact practices strategic planning guide so that we can have full acceptance, especially in marginalized communities? So anybody wants to get us started? Yoram?
Yes, I just wanted to say that you saw from what we shared that this misconception is in many religious groupings, and it extends to those outside those religious groupings. But what we have found in all the Christian, Muslim, and other faith groups which we have engaged, the idea of family planning is upheld. What they differ on is the method to use in achieving family planning goals. So I'll give you an example. If a religion says you should have many children, that's a family planning position. That religious group supports family planning. And for it wants you to have many children. Another one would say, no, we want you to have fewer children, and we only support this method. So again, that is the position. I think what we struggled with is when we find a religious group who has a position on family planning which is not well researched, which does not support the health of the mother and child, then it's quite clear that whilst we cannot impose, we respectfully engage the religious leaders in that group so that they go through a reflection. Because religious dogma changes, and it changes with reflection and new information, new knowledge, and a relooking at the scriptures. When we treat religious groups whose religious position we do not agree with in a dismissive way and belittling them, then we will not be able to engage in a dialogue that can produce positive outcomes. And this is part of the reason behind this guide which is being shared today. It is not the way, but it's an example of a way in which we can engage even those religious groups who we have made up our mind that those are just against family planning. If we engage them also with an open mind, bearing in mind that after our engagement, their positions might remain the same. And we have to respect that, because remember, religion is also a human right. The right to hold a religious belief, to associate with a certain religious group, is a human right. The freedom of conscience is a human right. It's not a right only when you agree with it. No, it is also a right when you don't. The most important thing is that that religious belief should support human life.
Can I add something?
Yes, please go ahead, Sheik.
Yeah, I think patience is very important in this exercise. Patience with religious leaders who are not knowledgeable of family planning dynamics. I told you myself that, I didn't know much about it until I got engaged. And I learned a lot through this project and doing, I learned doing. So we need to be patient with those leaders who are not being introduced yet to family planning. They have their ideas about, I just give you an example. Yesterday, we are here at the Ouagadougou Partnership Annual Meeting. In the opening session yesterday, one of the sessions, it was about the youth, because the theme is on youth, right? Youth health. A pastor from Cote d'Ivoire stood up and said he destroyed everything. They said, no, this is not allowed religion, Christianity. He's a Christian. He said, family planning is wrong because God has asked us to multiply. And he said that in his church, some women have come to him asking for him to pray for them because they can't have children, because they had been doing family planning before. So maybe, I don't know, the side effects, all those things. But anyway, the pastor has a very, very, very radical position. He said that the scriptures don't allow it, and there are examples of these women taking contraceptives that stop them from having children. So his conclusion is that it's not a good thing to do. You know, so he just messed up, you know, the whole session, and then said there were some people very angry and from among the audience and all that, calling him names and all that, whatever. But me, I was prudent enough to give him our argumentation, because our argumentation, I think, even an Islamic argumentation, but it's religiously inspiring anyway of texts. And then I gave him also the argumentation on the youth, which actually has Christian perspectives and all that, to tell him, well, because that's the only way to convince him. There's no way you convince him outside scriptures. That's what he believes. You need to give him scriptures that legitimize, that says that confirm that family planning is allowed. Indeed, it's not the people or participating in the Ouagadougou Partnership meeting that will convince him ever. It is religious scriptures and religious leaders who can convince him. Later on, maybe he can, you know, little by little, you know, be convinced, but you can't force him. It's just the way it is that Oriam says, you know, you have to be patient. It's a process. It's a transformative process. In our group in Senegal, we have people who were against, but now they are advocates. They have undergone this transformative process through from being totally detractors to being, you know, strong advocates of family planning. But it is a process that takes time and you know, needs patience. Thank you.
Wonderful. Thank you so much. Okay, let's get to one more question, and then we'll wrap it up with a few final thoughts from each of our speakers. So if you can share, what are the main themes that you address during training of religious leaders? And I am assuming this is to engage them in family planning programming.
Yeah, maybe I can start. I have already shared more on the tool we use, but one of the key approach to engage faith leaders in the family planning, you can't separate the family planning with the whole health issues. So not just picking it as one thing. The second is like to consider the relationship between spouse, especially for the faith leaders, because sometimes it is affecting the health of a woman and children if the issues of family planning are not being addressed. So that is also another key component, communication around this, and also how they make decisions together. And the third is raising awareness using the stories like about different methods that are available in the community, and also address misconceptions around those and allow them to discuss on those topics, and also raising awareness on the community services that are available to them if they want to know more. And then equip them. The fifth thing we do is like, how do you equip them to talk about this, to engage with your congregation? Of course, for us, each lesson has scriptures depending on the audience, to help them to also address those belief issues, or even explain more the perspective that they may have, which is based on the misinterpretation of scripture. So mainly, those are the key themes we have been addressing. Thank you.
Thank you very much, Clemens. And go ahead, please.
Okay, I just want to add that I think one of the strategies, you know, we're talking of strategies, right? That can work.
Yes.
Yeah, I think you know, like I said, the strongest entry point would be life-saving. You know, sacredness of life. When it is a matter of death, when you say that it contributes to reduce mother and child mortality, any religious leader will have to listen to you. You know, so focus on life saving, on the basis of sacredness of life first as an entry point, and then you can go into the other details. But for example, things like if you focus on demography, for example, then the dictators will tell you, you see, God has told us to multiply and all. Demography is a problem, but you something to avoid in the in the conversation, like to avoid facing the argumentation of those who are the pro-natalist and pro-multiplication aspects. But but the other one is just to be patient. You have to be patient. It's a gradual process, transformative process. Religious leaders have to be given time to absorb all these details and all that. Bearing in mind also that religion is not doesn't go into details. It's always a holistic approach. The most important thing is the final objective, which is the well-being. How to reach the well-being, But if we spend a lot of time in scientific details and all that, the religious leader can get lost in the messaging itself. Messaging should be centered on the well-being. How to get there using methods that are in line with religious teaching, that are acceptable by religion. That's why I always focus on terminology used by the actors in the health sector, family planning actors. Terminology is so important that you can change everything. Contextualize these terminologies, but allow people to call it something else rather than sexual and reproductive health or comprehensive sexual education or positive masculinity or whatever. Allow them to call them names that they are comfortable with, that are in line with their culture, that are in line with the religion, so that you reach your goal anyway, rather than using terminology that will hinder the problem, the project. And okay, thank you. I talked too much, maybe.
Thank you. That was very helpful. Okay, we have 1 minute left. Any final thoughts from any of our speakers? Anything that may not have come up that you want to share before we close?
Yes, a lot of development actors acknowledge the significant influence that religious leaders have over many development issues, including health. Unfortunately, when we engage with these powerful institutions and leaders incompetently, then we tend to start blaming them for standing in the way of the development, particularly when we realize that actually, if we choose not to engage them, we are not going to achieve our goals. That is the basic reality of the landscape, particularly the African landscape. So I think for everyone involved in family planning, I think it's important to start learning lessons which have led to contributions in changing the landscape of family planning, because the faith community are contributing, not just as people to educate others, but also to fashioning the policy landscape so that adequate funding, the correct policies, the correct legislation is in place to unleash the potential that family planning has on health outcomes. I submit.
Excellent. And with that final word, which was very helpful, I want to thank all of our panelists. Thank you so much for your time, for being here, taking time off from other duties. And thank you especially to CCIH and Mona and all the team in the background helping to make this webinar reality. Have a wonderful day, and I hope the information you've listened today is helpful in your family planning work. Thank you very much. Goodbye.
Thanks, everyone. Bye.
Bye.